Dexamethasone. Expanded lecture notes. Welcome to our in-depth exploration of dexamethasone, a potent and versatile corticosteroid that's been revolutionizing the way we manage inflammation and immune responses for decades. From its powerful anti-inflammatory effects to its critical role in emergency medicine, dexamethasone is a medication that's saved countless lives and improved the quality of life for millions. In this lecture, we'll dive into the fascinating world of dexamethasone, exploring its mechanisms, uses, benefits, and potential side effects, giving you a comprehensive understanding of this remarkable medication. Objectives. By the end of this lecture, learners should be able to 1. Define dexamethasone and explain its pharmacological classification. 2. Outline its history, chemical and physical properties. 3. Describe its mechanism of action, pharmacokinetics, and pharmacodynamics. 4. Discuss its clinical uses, especially in ICU, anesthesia, and emergency care. 5. Recognize contraindications, precautions, and side effects. 6. Compare dexamethasone with other corticosteroids. 7. Highlight current trends and research findings. 8. Provide patient education on dexamethasone use. Other names. 1. Generic, dexamethasone. 2. Brand names, Decadron, Dexasone, Maxidex, Ozurdex ocular implant. 3. Chemical, 9-alpha-fluoro-16-alpha-methylprednisolone derivative. Introduction to dexamethasone. 1. Potent synthetic glucocorticoid. Dexamethasone is a long-acting, highly potent synthetic glucocorticoid, which means it is a man-made steroid that mimics the effects of cortisol in the body. 2. High anti-inflammatory potency. Dexamethasone has 30 times the anti-inflammatory potency of hydrocortisone, making it a powerful medication for reducing inflammation and swelling. 3. Minimal mineralocorticoid activity. Unlike hydrocortisone, dexamethasone has minimal mineralocorticoid activity, which means it does not cause significant fluid retention, making it ideal for use in patients where fluid retention is undesirable. 4. Role in reducing PONV. Research supports the use of dexamethasone in reducing postoperative nausea and vomiting, PONV, which is a common complication of surgery. 5. Decreasing cerebral edema. Dexamethasone is also effective in decreasing cerebral edema, which is swelling of the brain that can occur due to various medical conditions. 6. Improving outcomes in COVID-19 related ARDS. Studies have shown that dexamethasone can improve outcomes in patients with COVID-19 related acute respiratory distress syndrome, ARDS, highlighting its potential benefits in managing severe respiratory illness. Debunking myths about dexamethasone. 1. Myth. Dexamethasone is only used for cancer. Fact. Dexamethasone is used in a wide range of medical specialties, including anesthesia, ICU, neurology, oncology, rheumatology, and emergency medicine, highlighting its versatility and broad therapeutic applications. 2. Myth. One dose of dexamethasone causes severe immune suppression. Fact. Single perioperative doses of dexamethasone, such as those used for postoperative nausea and vomiting (PONV) prophylaxis, are safe and effective, and do not typically cause significant immune suppression. Organizational definitions and approvals of dexamethasone. 1. World Health Organization (WHO). The WHO has listed dexamethasone as an essential medicine due to its effectiveness in various medical applications, including its anti-inflammatory, immunosuppressive, and antiemetic properties, highlighting its importance in global healthcare. 2. U.S. Food and Drug Administration (FDA). The FDA has approved dexamethasone for multiple uses, including the treatment of cerebral edema, postoperative nausea and vomiting (PONV), asthma, allergies, shock, and COVID-19 related acute respiratory distress syndrome (ARDS), demonstrating its broad therapeutic range. 3. British National Formulary (BNF). The BNF classifies dexamethasone as a potent glucocorticoid with negligible mineralocorticoid action, which makes it particularly useful in emergency situations and perioperative care where its anti-inflammatory effects are beneficial and fluid retention is undesirable. History of dexamethasone. 1. 1957. Dexamethasone was synthesized as a modification of prednisolone, a corticosteroid, with the goal of creating a more potent and longer-acting medication. 2. 1958. The first clinical use of dexamethasone is documented, marking the beginning of its use in medical practice. 3. 1960s. Dexamethasone was widely adopted for the treatment of cerebral edema and as an anti-inflammatory therapy, demonstrating its effectiveness in managing various medical conditions. 4. 2020. The Recovery Trial, a large-scale clinical trial, showed that dexamethasone provided survival benefits in COVID-19 patients requiring oxygen or ventilation, leading to its widespread adoption as a standard therapy for severe COVID-19 cases globally. Classification of dexamethasone. 1. Pharmacological class. Dexamethasone belongs to the glucocorticoid class of medications, which are synthetic steroids that mimic the effects of cortisol in the body. 2. Subclass. Dexamethasone is a subclass of corticosteroids, specifically a long-acting one, which means it has a prolonged duration of action in the body. 3. Duration. The effects of dexamethasone can last for 36 to 72 hours, making it suitable for use in situations where a prolonged anti-inflammatory or immunosuppressive effect is desired. 4. Potency. Dexamethasone is approximately 25 to 30 times stronger than hydrocortisone, a naturally occurring glucocorticoid, highlighting its high potency and effectiveness in managing various medical conditions. Chemical properties of dexamethasone. 1. Formula. The chemical formula for dexamethasone is C22H29FO5, which describes the arrangement of atoms in the molecule. 2. Molecular weight. Dexamethasone has a molecular weight of 392.5 grams per mole, which is a measure of its molecular size and weight. 3. Synthetic fluorinated steroid derivative. Dexamethasone is a synthetic steroid that has been fluorinated, meaning it contains a fluorine atom in its molecular structure, which contributes to its potency and pharmacological properties. Physical properties of dexamethasone. 1. Appearance. Dexamethasone appears as a white to off-white crystalline powder, which describes its physical form and color. 2. Solubility. Dexamethasone is practically insoluble in water, but soluble in alcohol and chloroform, which affects its formulation and administration. 3. Stability. Dexamethasone is stable under dry conditions, but it is sensitive to light, which requires it to be stored in a way that protects it from light to maintain its potency and effectiveness. Mechanism of action of dexamethasone. 1. Binds to glucocorticoid receptors. Dexamethasone works by binding to glucocorticoid receptors in the body, which triggers a series of downstream effects that ultimately modify gene transcription, changing the way genes are expressed. 2. Anti-inflammatory action. Dexamethasone inhibits the production of pro-inflammatory molecules, including phospholipase A2, COX2, prostaglandins, and leukotrienes, which are involved in the inflammatory response, thereby reducing inflammation and swelling. 3. Immunosuppressive action. Dexamethasone reduces T-cell proliferation and cytokine release, which helps to suppress the immune system and prevent excessive immune responses that can cause tissue damage. 4. CNS effect. Dexamethasone decreases vascular permeability and reduces cerebral edema by minimizing the amount of fluid that leaks out of blood vessels and into the brain, which can help to alleviate symptoms such as headache and confusion. 5. Antiemetic action. Dexamethasone inhibits the release of serotonin and substance P, which are neurotransmitters involved in triggering nausea and vomiting, thereby helping to prevent postoperative nausea and vomiting (PONV). Pharmacokinetics of dexamethasone. 1. Absorption. Dexamethasone has high oral bioavailability, meaning it is well absorbed into the bloodstream when taken orally, allowing for effective treatment. 2. Distribution. Approximately 70% of dexamethasone binds to plasma proteins, which affects its distribution and activity in the body. 3. Metabolism. Dexamethasone is metabolized in the liver via the enzyme CYP3A4, which breaks down the medication into its metabolites. 4. Half-life. Dexamethasone has a long half-life of 36 to 72 hours, which allows for once daily dosing and maintains its therapeutic effects over an extended period. 5. Excretion. Dexamethasone is excreted through the kidneys, primarily as inactive metabolites, which are then eliminated from the body. Pharmacodynamics of dexamethasone. 1. Onset. The onset of action for dexamethasone varies depending on the route of administration. It takes effect within minutes when given intravenously (IV) and within 1 to 2 hours when taken orally. 2. Peak effect. The peak effect of dexamethasone occurs 1 to 2 hours after oral or IV administration, which is when the medication reaches its maximum therapeutic effect. 3. Duration. Due to its strong binding to glucocorticoid receptors, the effects of dexamethasone can last up to 3 days, providing long therapeutic benefits despite its administration frequency. Storage and disposal of dexamethasone. 1. Storage temperature. Dexamethasone should be stored at a temperature range of 20 to 25 degrees Celsius to maintain its stability and effectiveness. 2. Protection from light and moisture. The medication should be protected from light and moisture to prevent degradation and ensure its potency. 3. Injectable solutions. Injectable solutions of dexamethasone should be protected from freezing to prevent damage to the formulation. 4. Disposal. Dexamethasone should be disposed of according to hospital policy for cytotoxic or steroid disposal, which ensures safe and environmentally responsible disposal of the medication. Drug interactions with dexamethasone. 1. 3 cypriot pounds A4 inducers. Medications like rifampicin and phenytoin can decrease the effect of dexamethasone by increasing its metabolism, which may reduce its therapeutic efficacy. 2. 3 cypriot pounds A4 inhibitors. Medications like ketoconazole and erythromycin can increase the effect of dexamethasone by decreasing its metabolism, which may increase the risk of side effects. 3. NSAIDs. Concomitant use of dexamethasone with NSAIDs may increase the risk of gastrointestinal bleeding due to the combined effects of corticosteroids and NSAIDs on the gastrointestinal tract. 4. Anticoagulants. Warfarin. Dexamethasone may alter the International Normalized Ratio (INR) response to warfarin, requiring close monitoring of INR levels to adjust warfarin dosing. 5. Vaccines. Dexamethasone may reduce the immune response to vaccines, which may decrease their effectiveness in individuals taking this medication. Clinical uses of dexamethasone. 1. Cerebral edema. Dexamethasone is used to reduce swelling in the brain caused by head trauma, brain tumors, or meningitis, helping to alleviate symptoms such as headache and confusion. 2. PONV prophylaxis. Dexamethasone is used as a perioperative antiemetic to prevent postoperative nausea and vomiting (PONV) in patients undergoing surgery. 3. COVID-19 ARDS. Dexamethasone is a standard of care for patients with COVID-19 who require ventilation, as it has been shown to reduce mortality and improve outcomes. 4. Asthma and allergies. Dexamethasone is used to treat severe asthma exacerbations, anaphylaxis, and severe allergic reactions, helping to reduce inflammation and alleviate symptoms. 5. Rheumatologic and autoimmune disorders. Dexamethasone is used to manage various rheumatologic and autoimmune conditions, such as rheumatoid arthritis and lupus, by reducing inflammation and suppressing the immune system. 6. Adjunct in chemotherapy. Dexamethasone is used as an adjunct therapy in chemotherapy to prevent nausea and vomiting, and also as an appetite stimulant to help manage cancer-related weight loss and malnutrition. Use of dexamethasone in ICU. 1. ARDS management. Dexamethasone is used in the management of acute respiratory distress syndrome, ARDS, caused by COVID-19 or sepsis, and has been shown to improve survival in ventilated patients. 2. Cerebral edema. Dexamethasone is used to reduce intracranial pressure, ICP, in patients with cerebral edema, helping to alleviate symptoms and prevent further brain damage. 3. Severe inflammatory states. Dexamethasone is used to manage severe inflammatory conditions such as systemic lupus erythematosus and vasculitis, helping to reduce inflammation and prevent organ damage. Use of dexamethasone in anesthesia. 1. PONV prophylaxis. A single perioperative dose of dexamethasone, 4-8 mg IV, is effective in preventing postoperative nausea and vomiting, PONV, in patients undergoing surgery. 2. Airway edema prevention. Dexamethasone is used to prevent airway edema in patients requiring prolonged intubation or undergoing airway surgery, helping to reduce the risk of respiratory complications. 3. Allergic reactions. Dexamethasone is used intraoperatively to manage allergic reactions that may occur during surgery, helping to reduce inflammation and prevent anaphylaxis. Use of dexamethasone in emergencies. 1. Cerebral edema. Dexamethasone is used to treat cerebral edema caused by trauma, tumors, or meningitis, helping to reduce swelling and alleviate symptoms. 2. Anaphylaxis. Dexamethasone is used as adjunct to epinephrine in the treatment of anaphylaxis, helping to reduce inflammation and prevent further symptoms. 3. Severe asthma exacerbations. Dexamethasone is used to treat severe asthma exacerbations, helping to reduce inflammation and improve respiratory function. 4. Spinal cord injury. Historically, dexamethasone was used to treat spinal cord injuries, but its use is now less common due to limited evidence of benefit and potential side effects. Nursing management of dexamethasone. 1. Monitor neurological status. In patients with cerebral edema, nurses should closely monitor neurological status, including level of consciousness, pupillary response, and cognitive function, to assess the effectiveness of treatment and detect changes. 2. Monitor blood glucose and electrolytes. Nurses should regularly monitor blood glucose and electrolyte levels, as dexamethasone can cause hyperglycemia and electrolyte imbalances. 3. Watch for signs of infection. Nurses should be vigilant for signs of infection, as dexamethasone can suppress the immune system and increase the risk of infections. 4. Patient education on tapering. Nurses should educate patients on the importance of tapering dexamethasone after prolonged therapy to prevent withdrawal symptoms and adrenal insufficiency. 5. Monitor for PONV. In perioperative settings, nurses should monitor patients for postoperative nausea and vomiting, PONV, and assess the effectiveness of dexamethasone in preventing these symptoms. Administration and dosage of dexamethasone. 1. IV/IM administration. The dosage of dexamethasone for IV or IM administration ranges from 4 to 20 mg, depending on the specific indication and severity of the condition. 2. Oral administration. Oral dosage of dexamethasone ranges from 0.5–10 mg per day, typically given in divided doses to maintain therapeutic levels. 3. Cerebral edema. For cerebral edema, an initial dose of 10 mg IV is often given, followed by 4 mg every 6 hours to reduce swelling and alleviate symptoms. 4. PONV prophylaxis. For prevention of postoperative nausea and vomiting, PONV, a dose of 4 to 8 mg IV is typically given at induction of anesthesia. 5. COVID-19 ARDS. For COVID-19 patients with acute respiratory distress syndrome, ARDS, a dose of 6 mg IV or PO once daily for 10 days is recommended to reduce mortality and improve outcomes. Side effects of dexamethasone. 1. Hyperglycemia. Dexamethasone can cause an increase in blood sugar levels, which may require adjustments to diabetes treatment. 2. Mood changes. Some individuals may experience mood swings, anxiety, depression, or other emotional disturbances due to the hormonal effects of dexamethasone. 3. Insomnia. Difficulty sleeping is a potential side effect, possibly related to the medication's impact on hormones and mood. 4. Fluid retention, less common. Dexamethasone causes the body to retain fluid, leading to swelling and weight gain, although this is less common. 5. GI upset. Nausea, vomiting, appetite changes, abdominal discomfort, and other gastrointestinal symptoms can occur due to dexamethasone use. 6. Increased infection risk. Dexamethasone's immunosuppressive properties can increase the risk of infections, as the body's natural defenses are suppressed. Serious side effects of dexamethasone. 1. GI bleeding, ulceration. Dexamethasone can increase the risk of gastrointestinal bleeding and ulcers, particularly when used in high doses or for extended periods. 2. Osteoporosis, avascular necrosis. Long-term use of dexamethasone can lead to bone loss and osteoporosis, increasing the risk of fractures, and avascular necrosis, a condition where bone tissue dies due to lack of blood supply. 3. Psychosis. In rare cases, dexamethasone can cause severe mental disturbance, including psychosis, especially in individuals with a history of mental health conditions. 4. Adrenal suppression with prolonged use. Long-term use of dexamethasone can suppress the body's natural production of cortisol, leading to adrenal insufficiency and potentially life-threatening complications if not managed properly. Contraindications of dexamethasone. 1. Systemic fungal infections. Dexamethasone is contraindicated in patients with systemic fungal infections, as it can worsen the infection by suppressing the immune system. 2. Hypersensitivity to dexamethasone. Patients who are hypersensitive to dexamethasone or any of its components should not receive the medication, as it can cause severe allergic reactions. 3. Concomitant live vaccines. Dexamethasone is contraindicated with concomitant live vaccines in immunosuppressed patients, as the medication can reduce the immune response and increase the risk of vaccine-related complications. Precautions with dexamethasone. 1. Diabetes mellitus. Dexamethasone can increase blood glucose levels, so patients with diabetes mellitus should be closely monitored and their treatment plan adjusted as needed. 2. Psychiatric illness. Patients with a history of psychiatric illness should be closely monitored for signs of mood changes, anxiety, or psychosis while taking dexamethasone. 3. Hypertension. Dexamethasone can cause fluid retention and increase blood pressure, so patients with hypertension should be closely monitored and their blood pressure regularly checked. 4. Immunocompromised patients. Dexamethasone can further suppress the immune system in immunocompromised patients, increasing the risk of infections and other complications. 5. Pregnancy. Dexamethasone should be used in pregnancy only if the potential benefit outweighs the risk to the fetus, as corticosteroids can have adverse effects on fetal development. Advantages of dexamethasone. 1. Potent anti-inflammatory and antiemetic effect. Dexamethasone has a strong anti-inflammatory and antiemetic effect, making it an effective treatment for various conditions, including cerebral edema, asthma, and postoperative nausea and vomiting. 2. Long half-life. Dexamethasone has a long half-life, which allows for less frequent dosing and improves patient compliance, as it can be administered once or twice daily. 3. Minimal mineralocorticoid activity. Dexamethasone has minimal mineralocorticoid activity, which makes it suitable for treating cerebral edema and patients who are sensitive to fluid retention, as it is less likely to cause edema or hypertension. Disadvantages of dexamethasone. 1. Prolonged suppression of HPA axis. Dexamethasone can cause prolonged suppression of the hypothalamic pituitary adrenal (HPA) axis, leading to adrenal insufficiency and dependence on the medication. 2. Strong immunosuppression with chronic use. Chronic use of dexamethasone can lead to strong immunosuppression, increasing the risk of infections and other complications. 3. Not ideal when mineralocorticoid activity is needed. Dexamethasone lacks significant mineralocorticoid activity, making it less suitable for conditions that require mineralocorticoid effects, such as adrenal crisis, where fludrocortisone or hydrocortisone may be preferred. Clinical considerations for dexamethasone. 1. Use lowest effective dose. To minimize side effects, dexamethasone should be used at the lowest effective dose for the shortest possible duration, tailoring treatment to individual patient needs. 2. Monitor blood glucose. Blood glucose levels should be closely monitored, especially in the perioperative period, as dexamethasone can cause hyperglycemia and require adjustments to diabetes management. 3. Avoid abrupt withdrawal. If dexamethasone has been used long-term, it should be tapered gradually rather than abruptly withdrawn to prevent adrenal insufficiency and withdrawal symptoms. Comparison of glucocorticoids. 1. Hydrocortisone has a glucocorticoid potency of 1 and mineralocorticoid potency of 1, with a duration of action of 8 to 12 hours. 2. Prednisone has a glucocorticoid potency of 4 and mineralocorticoid potency 0.8, with a duration of action of 12 to 36 hours. 3. Methylprednisolone has a glucocorticoid potency of 5 and mineralocorticoid potency of 0.5, with a duration of action of 12 to 36 hours. 4. Dexamethasone has a glucocorticoid potency of 25 and virtually no mineralocorticoid activity, with a duration of action of 36 to 72 hours, making it a long-acting glucocorticoid with potent anti-inflammatory effects. Additional information about dexamethasone. 1. Wide availability. Dexamethasone is widely available in various forms, including oral, IV, IM, ophthalmic, and topical formulations, making it a versatile medication for different routes of administration and indications. 2. Preferred in fluid-sensitive patients. Dexamethasone is often preferred when fluid retention must be avoided, due to its minimal mineralocorticoid activity, which reduces the risk of edema and hypertension. 3. Key role in palliative care. Dexamethasone plays a key role in palliative care, where it is used to improve symptoms such as appetite, pain, and nausea in patients with advanced illnesses, enhancing their quality of life. Current trends in dexamethasone use. 1. Standard therapy in COVID-19 ARDS. Dexamethasone has become a standard treatment for patients with COVID-19 who require respiratory support, such as oxygen therapy or mechanical ventilation, due to its ability to reduce mortality rates. 2. Increased use as perioperative antiemetic. Dexamethasone is increasingly being used worldwide as a perioperative antiemetic to prevent postoperative nausea and vomiting in patients undergoing surgery, thanks to its potent anti-inflammatory and antiemetic effects. Investigated in oncology for reducing chemotherapy-induced side effects. Researchers are exploring the potential benefits of dexamethasone in reducing chemotherapy-induced side effects, such as nausea and vomiting, and improving the quality of life for cancer patients undergoing treatment. Findings from the recovery trial and ongoing research. 1. The recovery trial, conducted in 2020, found that dexamethasone reduced mortality by 35% in COVID-19 patients who required mechanical ventilation and by 20% in those who needed supplemental oxygen. 2. The trial involved over 6,400 patients and showed that a 10-day treatment with 6 mg of dexamethasone once daily significantly improved survival rates among patients with severe COVID-19. 3. Ongoing research is exploring the potential benefits of dexamethasone in other areas, including 1. Neuroprotection. Investigating dexamethasone's role in protecting the brain from damage caused by inflammation or injury. 2. Sepsis modulation. Examining dexamethasone's effectiveness in managing sepsis, a life-threatening condition that occurs when the body's response to infection causes widespread inflammation. 3. Oncology support care. Studying dexamethasone's potential benefits in reducing chemotherapy-induced side effects, such as nausea and vomiting, and improving the quality of life for cancer patients. Patient education for dexamethasone use. 1. Do not stop abruptly. Patients should not stop taking dexamethasone suddenly, as this can lead to adrenal crisis, a potentially life-threatening condition that occurs when the body is unable to produce enough cortisol. 2. Report signs of infection early. Patients should be aware of signs of infection, such as fever, sore throat, or cough, and report them to their healthcare provider early, as dexamethasone can mask symptoms of infection. 3. Monitor for mood changes and other side effects. Patients monitored for mood changes, vision changes, and high blood sugar, and report any concerns to their healthcare provider, as dexamethasone can cause these side effects. 4. Carry steroid card, medical ID. Patients on long-term dexamethasone use should carry a steroid card or medical ID to alert healthcare providers of their steroid use in case of an emergency. 5. Take oral dexamethasone with food. To reduce gastrointestinal irritation, patients should take oral dexamethasone with food, which can help minimize stomach upset and other GI side effects. Conclusion on dexamethasone. 1. Potent and long-acting glucocorticoid. Dexamethasone is a highly potent and long-acting glucocorticoid, making it an effective treatment for various medical conditions. 2. Vital roles in multiple medical fields. Dexamethasone plays a crucial role in critical care, anesthesia, oncology, and emergency medicine, showcasing its versatility and importance in different medical specialties. 3. Ideal for edema control. Its lack of mineralocorticoid activity makes dexamethasone an ideal choice for conditions where controlling edema is crucial, such as cerebral edema or other conditions where fluid retention is a concern. 4. Life-saving role in COVID-19 ARDS. Recent evidence from clinical trials has highlighted dexamethasone's life-saving role in treating patients with COVID-19 who develop acute respiratory distress syndrome, ARDS, reducing mortality rates and improving outcomes. Take-home tips on dexamethasone. 1. Potency comparison. Dexamethasone is 25 to 30 times stronger than hydrocortisone, making it a highly potent glucocorticoid that requires careful dosing and monitoring. 2. Ideal uses. Dexamethasone is particularly useful for preventing postoperative nausea and vomiting (PONV), treating cerebral edema, and managing COVID-19 ARDS, due to its potent anti-inflammatory and antiemetic effects. 3. Lack of mineralocorticoid effect. Dexamethasone lacks significant mineralocorticoid activity, which makes it unsuitable for treating adrenal crisis, where mineralocorticoids like fludrocortisone are typically needed. 4. Dosing convenience. Dexamethasone's long half-life allows for once-daily dosing, making it a convenient treatment option for patients and improving adherence to therapy. 5. Monitoring requirements. Patients taking dexamethasone should be monitored for changes in glucose levels, signs of infection, and psychiatric status, as the medication can cause hyperglycemia, immunosuppression, and mood changes. Professional quote on dexamethasone. The quote, "Dexamethasone is the sharpest tool in the steroid arsenal, powerful, precise, and life-saving when used wisely," highlights dexamethasone's potency and effectiveness as a glucocorticoid. It emphasizes the importance of using dexamethasone judiciously, taking into account its potential benefits and risks, to achieve optimal therapeutic outcomes and minimize adverse effects. Thank you for watching. If you liked this content, don't forget to like to show your support, comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.